The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone. Welcome again to another edition of Boomer Generation Radio, coming to you live from the studios of WWDB in Greater Philadelphia, AM 860, and streaming live on WWDBAM.com, Boomer Generation Radio. You can reach us with ideas or suggestions by dropping us an email at boomergenerationradio@gmail.com. We have a very interesting show for you today. If you want to ask a question of our next guest, Dr. Judith Curtin, a doctor of audiology and the owner of ABC Hearing Net. The call-in number in a couple of minutes is 610-664-4100. And we are very pleased to welcome to our show, Boomer Generation Radio, Dr. Judith Curtin. And we want to remind you that this portion of Boomer Generation Radio is being brought to you by Kendal, a system of not-for-profit communities and services located in 8 states in the Northeast, Mid-Atlantic, and near Midwest regions of the United States. Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. To learn more about Kendal, that's Kendal, we invite you to visit kendal.org or call toll-free at 888-759-0128. That's 888-759-0128. That's kendal.org. Dr. Judith Curtin, the owner of ABC Hearing Net, doctor of audiology, teacher at Westchester University, correct? Welcome to Boomer Generation Radio. We are going to talk about something that I would imagine a lot of boomer families and boomers themselves have dealt with or are starting to deal with, and that is aspects of hearing loss. And this may or may not be a reflection of too many rock concerts in the 60s or 70s or being married to earphones, but this is a real issue. I've seen it in my family, and I'm sure you see it all the time in your office. The NIH, the National Institutes of Health, have given us statistics. Just from your perspective, your profession, your practice, how prevalent is hearing loss amongst baby boomers?
Well, it's inevitable.
Inevitable?
It's inevitable.
Inevitable?
You will be seeing me someday.
That's okay. Goodbye.
Okay. First of all, I think people think it's an aging, you have to be old to have hearing loss. And it doesn't. It happens very young. I would say 30% of the people in our practice are between the ages of 40 and 60 years of age.
How many? 30%?
About 30%.
Wow. Okay.
Hearing loss is very insidious, and it's hard to detect. The typical pattern of losing hearing, you first start to lose just a few sounds, like the S, the TH, the F, the K, and you think, oh, that's not so bad, just missing a few sounds. But they're the grammatical tags of English, and they change the meaning of a word in a second. So people don't lose hearing, flat out, all hearing. They lose clarity. And that's really the complaint that people have. It's just, it wasn't clear. Maybe it was the acoustics in the environment. Maybe in groups it was the background noise was too loud. But that loss of clarity, or missing the punchline, or not quite getting the movie details when people are talking, is the beginning of hearing loss. It doesn't mean you need a hearing aid, but you do need to have your hearing checked so that you're in charge of your hearing and that the hearing loss is not in charge of you.
And so the word inevitable, I'm still stuck on inevitable.
Sorry.
It woke me up. So and this presents its, everybody, right? Everybody.
It's kind of like you need glasses at 40.
Mm-hmm.
I personally, if I could change anything, I would have a hearing test every 5 years once you hit 50.
Really?
Yeah. And I think because the repercussions of untreated hearing loss are so great.
Give me an example of...
most people start thinking they're losing their memory function
mm-hmm.
when it's only hearing loss.
Well, Well, I mean, yeah. Talk about the connection to that. Yeah.
Well, when speech starts to be less clear to you, your brain has to take over. So if somebody said, "I don't feel very well, I'm going to go upstairs and go to bed," everybody thinks, "Oh, she said go to bed," but I didn't. I said go to bed, and your brain starts filling in what it thinks belongs there, and you don't realize this is happening. The other side of it, too, is that you understand people one-on-one because your eyes start to hear. You know that expression, I hear better with my glasses on, or something like that. That's just speech reading, which I teach at Westchester University, by the way. You start to supplement what you can't hear with your knowledge of language and with your vision. It's great because it works wonderfully, but it starts to take a toll on your cognitive skills. Your cognitive energy is being diverted to decipher a message rather than respond to a message. So it becomes more complicated taking in new information when you're trying to figure out, did they say this or did they really say this? When you start mishearing things, they can be quite funny, but you have to give 100% of your attention to somebody as you start to lose your hearing.
Do people get concerned that there's something? I think you alluded to this. A person's losing their hearing. They may just sort of like they don't want to. They drift off, and will that perception be that there's something wrong mentally? I may not be expressing this correctly.
Well, the biggest fear in aging is your memory.
Correct.
All right.
Correct.
And knowing that, I find that people who have hearing loss attach it to memory function before they attach it to hearing loss.
Really?
And it's just such a simple, easy thing to fix. It takes a good hearing aid on the right ears. Not everybody is successful with hearing aids. It gives you 10, 15 years back of your life easily. Is
there a lot of denial with this?
Well, you had mentioned that earlier. Denial is one of those words that I just want to rip out of the books.
Okay, so I won't use it.
No. I want to explain it a little bit because that's where all the arguments come from. Mm-hmm. A person who has a hearing loss, like I said, loses clarity first. But if you say to them, you can't hear, they'll say, I can hear, you just don't speak clearly. And so every time you say you can't hear, they're going to support that fact because they actually do hear. They hear, oh, yeah. What are you doing? So they're not hearing clearly. But if you said to them, you're not hearing me clearly, are you? They would say, no, I'm not. So the arguments that go on about hearing is, I describe to my students, it's like a beach ball. When I'm holding a ball and the stripes are red and yellow and orange and blue, people are arguing over different things. I think when people are, quote, unaware of the scope of their loss, a hearing impaired person is the last person to realize how blatantly obvious it is to everybody else and how much of a burden it is to everybody else when they're hearing impaired. Because you don't really own your disability until you get a hearing aid. Until then, you're quite handicapped.
So let's talk a little bit about the acquisition of hearing aids.
Good.
Okay? I mean, I know, I'll personalize it. When my mom in her 80s, after a series of conversations, decided that we would go to the audiologist, and we had these conversations, and she got fitted with hearing aids, et cetera, et cetera. It was a major...
Did she wear them?
She wore them when she wanted to, and when it was convenient, or when it was convenient for her to forget to put them in, she did. I found that to be it's sometimes humorous and sometimes very frustrating. But what's the tipping point? What's the tipping point? We all have people listening who may have mom or dad. They're taking care of them. They're noticing some of this, what you're talking about, this lack of clarity, this sort of like concern about hearing. What's the tipping point where you have to say, okay, we're going to make that appointment to talk about the hearing aid? Or is there a tipping point?
There really is. I mean, and it's different for everybody. Usually it's some situation, usually a family gathering, where they missed everything. Or they were completely off topic and felt foolish. And it's once a person has that experience, then it's very easy for them to come into compliance. Everybody comes into my office terrified, absolutely terrified, and they walk out. I would say the majority of them relieved and happy.
Terrified about what?
It's really hard to wrap around. It's first of all, nobody wants a hearing aid. I don't want a hearing aid. I mean, it's just you don't want it. But until they're face to face with the stress, you were talking about stress and cardio issues. Until they're face to face with the stress that hearing loss causes, and they experience the relief, and that's part of my job, is to take them where they are with the stress that the hearing loss is causing, show them the stress. I will do different things. I'll talk to them when they can't see my mouth. I'll talk to them at a normal conversational level. I'll do different things so that they can feel the energy that's being taken from them while they're listening. And then the relief that a hearing aid brings. And the hearing aid itself sells itself. The problem is you have to trust who you're dealing with. You have to be very comfortable with the person you choose to be your practitioner. Because you have to be able to complain, and you have to give it back. You have to be comfortable giving it back if it's not working for you.
The technology of hearing aids.
It's fabulous. Could
you just walk us through, because I'm sure the technology has changed from that old days in the movies with, just a big thing. I've seen them. You can't see them.
No.
You can't see them.
No. Very few hearing aids can be seen today. And everybody cares how they look. I don't care if they're 102.
Right.
They want that hearing aid to be tiny. And they are. They have rechargeable hearing aids. We sell a hearing aid, the Lyric, that's completely in the ear. I change it every 2 months for somebody. It's a perfect hearing aid for somebody who can't manage batteries. Hearing aids have all this Bluetooth capability now. So you see people walking around with crickets in their ears, on Bluetooth. You can have your cell phone talk to your hearing aids. The phone can answer.
Get out of here.
You press the button and you talk to your hearing aids. Your hearing aids get the amplification in the shape and pattern it needs to hear clearly. In fact, you can go into an environment, and if you don't like that environment, you pull out your iPhone and you can adjust the microphone in your hearing aid to quiet down the background noise. So they're pretty
cool.
Sexy. They really are. They're wonderful.
That's a far cry from.
And people think, this is the interesting thing about Bluetooth. People think Bluetooth is for the elder or for the young. Yeah. It's not. Many people break their hips trying to answer the phone. You can go to somebody's room, and they'll have 6 phones. One in the bathroom, one by their bed, one by the chair they sit in. All they have to do is keep that phone with them, and the phone rings, they answer it. Bluetooth is wonderful for the elderly because they don't have to rush to answer the phone.
That's. I never actually thought about that.
A lot of people don't.
That's a pretty interesting.
Yeah.
Speaking of cell phones, there's maybe it's not mythology or it's urban legend that cell phones, everybody attached to them, almost hermetically sealed to certain kids, will impact hearing loss. Is that true? Based upon your experience?
Boy, I don't worry about. I worry about not what is it? It's not iPods.
Yeah,
that's what I worry about. iPods become hazardous. Not so much when they're listening in quiet, but it's once you get on the bus and you try to turn it up to override the background noise. That's when you have the noise.
It's like
exposure.
The subways in New York when you can ride the subways and you'll hear 3 people away what they're listening to.
That's when it's a noise exposure. Yeah.
We're speaking with Dr. Judith Curtin, the doctor of audiology and the owner of the ABC Hearing Net on Boomer Generation Radio. We'll be right back with Dr. Curtin in a minute. I just want to remind you that this portion of Boomer Generation Radio is being brought to you by Kendal Outreach, serving the field of aging by raising public awareness and advocacy around important issues of older adults. Through education, training, and implementation of comprehensive approaches to safe, individualized long-term care practices, Kendal Outreach has been sharing Kendal's approach to quality care with consumers, advocates, providers, government agencies, and related organizations since 1989. And to learn more, visit Kendal.org. That's, again, Kendal.org, and click on Outreach. We're very pleased to, again, talk about Boomer Generation Radio's affiliation with the Kendal Corporation. I was down there at the corporate offices yesterday, and Bill and Burl were gracious hosts, and it's a great facility, and they do great work. So, again, that's the Boomer, that's the Kendal Outreach Program, Kendal.org, their website, and click on Outreach. And again, their toll-free number for information is 888-759-0128. Dr. Judith Curtin, Doctor of Audiology, and the owner of abchearing.net, professor at Westchester University. We're speaking with Dr. Curtin here on Boomer Generation Radio, just off the topic of Bluetooth-enabled hearing aids, which I think is really, really, really cool. I've heard a lot, and I'm sure you, in your practice, heard a lot about these cochlear implants.
Right.
So, what is that?
I've been involved with cochlear implants in the 80s when they were still experimental.
So, what is that?
It's basically let's go back to anatomy a little bit. There's 4 parts to your ear. There's your outer ear, which is just where your wax would grow, your cerumen. There's the middle ear, which is responsible for aeration. You run into trouble with your middle ear when you're flying. Then there's your cochlea. That is your organ of hearing. That's where all your hair cells are located. When you reach the limits of what a hearing aid can do, when you're getting like less than 30% of sentences, and amplification is really not helping you at all, what they do is they go in and they thread. The cochlea looks like a little snail. They thread a little electrode array through the cochlea, and it stimulates the auditory nerve itself and sends the electrical impulse to the brain through the normal pathway that the hair cells that are diminished would normally do. It's more like, those pictures, those pixel pictures, when you back off, you can see that it's a collection of, it's a portrait, but when you're close up, it's just a little picture of little pictures. It's pixel hearing, so it's not as rich and beautiful as what you hear. But tell that to a child who's born, once they get their implants at a year, by kindergarten, you would never know that child was deaf unless you took that implant off them. Now, when I love implants. I have met one person, and I've dealt with a lot of implants. I've only met one person who didn't like their implant, and that person was an adult person who was deaf their entire life. So the implant didn't work for them. But for those people, you were asking about a 90-year-old, what I thought about the quality of life. With 90, you don't know if you're going to be that one that's going to be 102 or 105. It restores you. It restores communication, and that's what separates us. That's what makes us so rich in life. Communication, when it breaks down with hearing loss, is, as you know, is horrible. When your parents can't hear or your family can't hear, you don't even like to talk to them because it's so much work. And that communication is felt by every hearing impaired person, that stress. Cochlear implants restore communication, and that's all of these apparatuses are about restoring communication. They're fabulous. Are they as clear as you and I speaking? No, they don't have the rich lower tones. But will they restore clarity? You'll have a lot of clarity. Interesting enough, when a person first gets their cochlear implant, they can't tell a male voice from a female voice because it restores most of the consonants. It doesn't restore the vowels as much. And vowels is what gives speech its richness and warmness.
In what way? I've never heard that.
I'm academic.
No, that's
and
okay.
If we go down
vowels,
this, we'll
vowels. Say that again. Vowels.
It's like the treble and the bass in your stereo.
Yeah.
If you turn up the bass, you have the warm and the beats and the.
So somebody getting a cochlear implant really at the beginning can't distinguish between those tones or the vowels, the vowel tones. The
vowels are harder for them to hear, but the consonants come in. But consonants give the clarity to speech and the meaning to speech.
Is there still a controversy in the hearing impaired community with cochlear implants?
It's interesting that you asked that because I was just talking with my students. I think it's less and less.
Mm-hmm.
it certainly, when I was involved in the 80s, it was horrible. It was just, I worked with one child and I felt like I was playing Solomon. It was like, is this worth it to this child's well-being? It was, but it really was not nice. And that's years ago, 25 years ago. Cochlear implants have transformed deaf education. I think there's more of a respect for those people who are born deaf and choose ASL as their primary language.
Mm-hmm.
So I don't think
ASL being American Sign
Language.
Right.
It's the naturally evolved language of people who are deaf, and there are huge communities that are very fluent in ASL and families. But 90% of children who are born deaf are born to hearing parents.
Right. Yes.
And ASL is like any language. Once you're an adult, it is very difficult to acquire a second language. Kind of like if you were a child, were born deaf, and you had to learn Russian to talk with them. It's not going to happen. You're not going to be fluent. You don't have enough models around you, or and you're busy and you're working and you're raising a family. So your level of communicative competence is going to be quite diminished if that's the only language your child can access.
One of the other issues I've heard from boomers dealing with their hearing and certainly dealing with their parents is something called tinnitus.
Oh, tinnitus.
Tinnitus. Okay,
yeah,
some Philadelphia accent.
No, tinnitus and tinnitus are acceptable. It's like either and either. Okay, tomato.
And from my old neighborhood, was once described to me as like a ringing in the ear. Is that what that is?
Yeah.
Is that
it's any sound in the ear? It can be a ringing, it can be a roaring, it can be a clicking, it can be a pulsing. So it's anything that bothers you.
And where does this come from? And how prevalent is it?
It's very prevalent.
Oh,
it's very, very prevalent.
It's not inevitable, is it?
No, no, it's not as inevitable. And it's not always disturbing either. Uh-huh. It's when it becomes well, sometimes it's a sign of cardio issues.
Really?
Yes. The pulsing is more cardiovascular issues. The high blood pressure can cause ringing.
But I know people who...
Noise exposure will cause ringing. That's a sign of damage to your hair cells.
Oh.
Aspirin causes ringing.
Really?
Almonds makes my ears ring away.
Almonds?
Almonds, yeah. So allergies can cause... your dental malocclusion can cause ringing. So when you have tinnitus and it's bothering you, you really need to work with somebody who looks at you holistically.
Mm-hmm.
So that they can figure out. They usually end up first with the audiologist, but you do have to look at the whole person. Lyme's disease can cause tinnitus. You really have to rule out. It's a question of ruling out. And then treatment varies by the severity of it. The severity has to do with how much does it bother you. As long as you've ruled out all medical problems, a tumor can cause tinnitus. So you have to rule out that all the time. Then you manage it with masking the noise and therapy to teach you how not to focus on it.
Is it just sometimes you just say, you just deal with it, live with it, unless it's really overwhelming? Often
you have to live with it, but there's ways to cope with it. As a counselor, you know that I'm trying to think of the term that they use with like being in the here and now. What's that type of?
Being present, you mean?
Yeah, okay. and not.
This is just, but it's not the normal. Like if somebody, we were talking before in the first segment about exercise, and somebody works out and they're exercising, and they may then stop and they'll literally hear their heartbeat, and then it'll just disappear.
Well, that's just Eustachian tube. Yeah,
it is. Okay.
Yeah, so that's nothing. But exercise, heart disease, and hearing are interrelated.
How?
The heart pumps the blood that feeds all the microvessels, and the microvessels to the ear are the stria vascularis. And as your heart weakens, your peripheral arteries are the first to weaken. Mm-hmm. So that's going to starve your ear for the oxygen and the energy and food that it needs. So exercise, go out and do it.
It's amazing. Every time we have a conversation with anybody from the medical field, it comes back to this fact that everything. I try to teach my students this as well. Everything is interrelated.
It is.
It's just amazing that this holistic approach. But everything. I mean, the heart, the hearing, everything is in the body is interrelated. The mind, the body, the soul, the stress, the non-stress. It's just fascinating. And yet we're still persisting in many times in a medical system where everything is isolated.
Right. And you can't treat somebody as an isolated person. I mean, that's what I was saying to you. The hearing aid and the cochlear implants, they're bridges to communication.
Mm-hmm.
They're just a small part. I don't know how much more time we have, but I would like to explain hearing loss at a kind of a simplistic level so that people can understand.
We have about 3 minutes, so go for it.
I'll do it very quickly. The typical hearing loss of most people, and I would say 90% of the aging population, and when I say aging, I'm talking 40, 50, 60, 70, 80, okay, is that if you can think of hearing as a piano keyboard, you retain your ability to hear middle C very, very well. But as you go up on the register to the right, your hair cell, the intensity for those sounds to be heard, you have to bang harder with your right hand than your left hand. So the consonants are up on the right side of the piano. So when people say, how are you, when they have a hearing loss, they only hear the left hand saying, how are you, the vowels.
Mm-hmm.
What hearing aids do is they provide the amplification of the upper register and even off your hearing. So it fills in the details that are missing. And it does it beautifully nowadays. So that's a real quick analogy.
Summary of
and when
hearing.
people say what, when people are hearing impaired, they'll say what. And as soon as somebody says what, we talk loud. And then don't talk so loud I can hear, because you're banging on middle C.
Mm-hmm.
It hurts their ears.
Should somebody get a hearing test every year as part of their annual physical?
No, but 5 years.
5 years.
But now once they start having declining hearing, I'm 62, and I've got one frequency that's a little iffy, but I teach and I'm in a very listening environment. I'm sure I'm going to be in hearing aids within the next 2 years, but that's early. My needs are different than your needs might be.
Mm-hmm.
A psychiatrist certainly needs to be in a hearing aid before somebody who's working at an IT job,
right,
and doesn't have to interact. So it's really about what are your communication demands dictates when you get amplification. When you're ready.
We've been speaking with Dr. Judith Curtin, the owner of ABC Hearing Net. That's in
Westchester.
In Westchester. I was just going to ask you where you're located.
Yeah.
Doctor of Audiologist. Somebody wants to real fast in the minute we have. If somebody wants to get a hold of you, where do you have a website? Or?
I do. It's ABC Hearing Net, and you can send me something through the web. It's abchearing.net or just ABC Hearing Net? Well, it's our website. It's abchearing.net.
.net, okay.
And it's Dr. Curtin. And
thank you.
My email is the same, info at jcurtin@abchearing.net.
This is a reminder that this portion of Boomer Generation Radio today has been brought to you by Kendal, a system of not-for-profit communities and services that advocates for and empowers older adults to reach their full potential. Together, we are transforming the experience of aging. And again, a reminder that to learn more about Kendal, which is Kendal, we invite you to visit kendal.org or call toll-free at 888-759-0128. Dr. Judith Curtin, I want to thank you very much for being a guest here on Boomer Generation Radio. I wish you much joy and happiness and good hearing. And the word inevitable will stay with me all day. So thank you very much for being a guest. To all of you, we'll see you next week on Boomer Generation Radio. Thank you for joining us.